The monitors were already screaming when she walked back through the doors. She wasn't supposed to enter anymore. 10 patients, 10 beds, blood pooling fast beneath gurneys, while residents stood frozen with their clipboards in the wet and their protocols and their clean white coats. Dr. Kevin Hale, chief trauma surgeon, 22 years of awards on his office wall, had both hands braced against the nursing station counter and wasn't moving. Nobody was moving. The room smelled like burned skin and copper and something worse underneath, and the only person doing anything at all was the nurse they had suspended 40 minutes ago. She still had the termination paperwork in her scrub pocket. Before we go any further, if you've never been here before, hit that subscribe button right now. Every week, we bring you stories like this. One story is about people who got pushed down, written off, and then made everyone who doubted them regret it. Drop a like on this video and tell us in the comments what city or country you're watching from. I want to see exactly how far this story travels. Now let's go back to the beginning. Coastal Ridge Medical Center sat at the edge of Bellport, Virginia, close enough to the naval base that on quiet nights the staff could hear aircraft moving low over the water. It was a level 1 trauma facility, which meant it received the worst cases, the car accidents on the interstate, the industrial injuries from the shipyard, the overdoses, the knife fights, that hit people in the middle of dinner. It also received military casualties when the base hospital was overwhelmed, which happened more often than the administrators liked to admit. Claire Navarro had worked the ER there for 4 years. She was 32, lean, with dark circles she'd long stopped trying to conceal, and hands that moved faster than most people's thoughts. She kept her hair pulled tight, wore no jewelry on shift, and had a habit of going absolutely still right before something went wrong, not frozen, just focused. The way a person goes quiet when every piece of information they have suddenly lines up into a single decision. Her colleagues found it unsettling. Her supervisors found it insubordinate. She had done 6 years as an Army combat medic before nursing school. 2 deployments, forward operating bases in places that never made the news, treating injuries that didn't resemble anything in the textbooks, because textbooks were written in hospitals with equipment and lighting and time. In the field, you worked with what you had. You made the call with the information available. You didn't wait for someone with more stars on their collar to confirm that the man in front of you was dying, because by the time confirmation arrived, he usually was. That was the problem. That had always been the problem. The shift started at 600, which meant Claire was there at 545. Coffee in hand that she didn't taste. Patient board already filling up. Tuesday morning in the Bellport ER, ran hot weekend damage people, had tried to walk off and couldn't. Construction injuries from the base expansion project up the road. The usual parade of things that had gone wrong at the worst possible time. By 8 o'clock, bed 7 held a Navy petty officer named Ramos, who'd come in complaining of chest pain and dizziness. The overnight intern, Dr. Patel, 26 years old, 2 months out of medical school, still carrying the careful, terrified energy of someone who was acutely aware of everything he didn't know, had ordered an EKG and was waiting on a cardiology consult. Claire watched Ramos from across the room. She'd been watching him for 6 minutes, the way she watched patients without appearing to watch them, taking inventory of small things that didn't belong in the picture. The way his breathing was shallow at the top. The way he was working harder than chest pain alone could explain. The color of his lips not cyanotic yet, but trending. His neck veins elevated. She crossed the room. Dr. Patel. She kept her voice low, stepped up beside him at the bedside. His JVD is elevated. Trachea's shifting. Patel looked at her, then at the patient, then back at his tablet. Cardiology is on their way. They'll do a full assessment. That's tension pneumo. She said it flat. Not a suggestion. A finding. He needs decompression now. We don't have imaging confirmations. His blood pressure is dropping. She'd already checked it, twice 60 seconds apart. He has maybe 3 minutes before this converts to arrest. Patel hesitated. That specific hesitation, institutional, liability conscious, trained into people by a system that punished wrong action, more than it punished no action, was the kind that killed people. Claire had watched it happen before, in other rooms, in other countries, with worse lighting and no backup. She picked up the needle. She did not ask again. It took 4 minutes, second intercostal space, mid-clavicular line, 14-gauge angiocath, and the audible rush of trapped air that proved her right and moved the satellite pulse oximeter from 78 and falling to 91 and climbing before doctor. Patel had finished processing what he'd watched. Cardiology arrived 6 minutes later, assessed the situation, and agreed with everything she had done. Ramos would have been in cardiac arrest before they cleared the elevator. Claire wrote her note, flagged the chart, and returned to her other patients. She didn't say anything further about it. There was nothing to say. The man was alive. The reasoning was documented. She moved on. But Patel said something to the charge nurse. The charge nurse said something to the department supervisor. The department supervisor filed an incident report with nursing director Sandra Morse and Dr. Kevin Hale, chief of trauma surgery at Coastal Ridge Medical Center. By noon, Claire was sitting in a conference room she had sat in before. Sandra Morse was 51, sharp, dressed, with reading glasses on a lanyard, and the particular manner of a person who had spent 2 decades managing people smarter than her in ways she was not equipped to acknowledge openly. She had come up through hospital administration, not medicine. She understood organizational charts, liability matrices, CMS compliance audits, and the optics of institutional decision-making. She did not understand what it looked like when a patient's trachea shifted under a fluorescent light at 8:14 in the morning, or what it cost to wait. Dr. Kevin Hale sat beside her. He was 60, broad through the shoulders, and wore his seniority the way certain men wore expensive watches constantly, conspicuously, as evidence of something that needed proving. He had trained at Johns Hopkins, which he managed to work into most professional conversations. He was technically gifted in the operating room. Claire had heard that from people she trusted. He was also the kind of surgeon who needed the room to know he was technically gifted, which was a separate quality entirely, and occasionally a dangerous one. "You performed an invasive procedure without physician authorization," Sandra said. She had a folder open in front of her, without a written order, in direct violation of this department's chain of command. Dr. Patel was present at the bedside, Claire said. "I communicated my clinical assessment clearly. He didn't act. He was appropriately waiting for the specialist consult." Hale leaned back in his chair, the posture of a man settling in for a conversation he considered already decided. That is the protocol. That is how this department manages complex presentations. The patient didn't have time for the protocol. That, he said, precisely like he was placing a period at the end of something, is not your call to make. You are a nurse, Ms. Navarro. An experienced nurse, I'm certain, but a nurse. You assess, you document, you communicate to the physician, and you wait for the physician to decide. That is the system. That is what this system exists to do. Claire looked at him steadily. The system would have killed him. Silence dropped into the room like something physical. Sandra closed the folder. "We've had concerns regarding your approach to authority before this incident. The patient is alive." This incident, Sandra continued, with the practiced smoothness of someone experienced at talking over inconvenient facts, represents a pattern of unilateral decision-making that creates significant legal and institutional exposure for this hospital. Whatever experience you developed during your military service, it does not constitute a license to bypass clinical governance structures. "My nursing license constitutes my license," Claire said. "And 6 years of forward-deployed trauma medicine taught me how to read a patient who has minutes left, not hours." Military field medicine The channel was active and crowded multiple units, transmitting simultaneously the overlapping traffic of a large-scale incident coming together in real time. Fire units, EMS dispatch, Coast Guard frequency, and beneath it, a specific radio protocol structure she recognized from uniform, a code pattern the Army used for mass casualty events of military origin. She hadn't heard it in 4 years, and she recognized it immediately, the way you recognized certain smells or certain silences. Then the dispatcher cut through the cross traffic, voice level and clear. All units. Confirmed large-scale explosion, Naval Station Bellport, Building Complex 7, and adjacent structures. Multiple military and civilian casualties reported. Full MCI protocol in effect. Coastal Ridge Medical Center, designated primary receive, trauma level. First transport wave estimated 10 to 14 minutes out. Incident classification, classified exercise accident, nature unspecified. All receiving facilities prepare for mass casualty intake. The charge nurse, Torres, a decade of ER experience, steady as a wall, hung up the phone he'd reflexively grabbed when the radio started and looked at the patient board. Then he looked at Claire. She still had the suspension paperwork in her left scrub pocket. They both knew it. He looked at her, and she looked at him. And the calculation was fast and wordless, what was actually needed in the next 20 minutes, and whether a piece of paper changed the answer to that question. "How many trauma bays can we open?" Claire said. "Clear to 18 if we push the non-criticals to overflow and pull in the procedure room. Do it now, not when they're pulling in. And call the blood bank right now, before they arrive. Tell them mass casualty protocol. Release everything they can on type O negative and start cross-matching whatever they have typed from recent admits." She was moving toward the supply corridor as she talked. "Get both burn kits out of storage, the big ones. And I need airway carts at every other bay." Torres was already on the phone. Claire pulled the suspension document out of her pocket. She looked at it for 1 second, not with hesitation. Just acknowledgement. Then she set it flat on the counter, smoothed the fold with 2 fingers, and walked to the sink to scrub her hands. Plus. She put on fresh gloves. She walked to the first trauma bay. They arrived at 13 minutes, which was fast, which meant the scene had been organized quickly, which meant the military had their own triage running at the site before the civilian units even arrived. The first ambulance brought 2 sailors' blast injuries, shrapnel wounds across the forearms and neck, one of them with a partial degloving injury on his right hand, wrapped in absfield, dressing applied by someone who knew what they were doing. The second unit came in 30 seconds behind the first, carrying a man with penetrating abdominal trauma and a young woman, early 20s, tourniquet on her right leg, applied tight at mid-thigh. Then the third, the fourth, they stacked. By the 12-minute mark, 9 patients occupied active bays, and the board showed 2 more inbound. Claire moved through it, the way she moved through it, when it was real. Not performance, not adrenaline, just function. Every motion connected to a specific purpose. No flourish, no wasted steps. She assessed the young woman with the tourniquet first, because tourniquets that had been on longer than 20 minutes started costing limbs instead of saving lives. And this one had been on at least that long by the color and temperature of the foot below it. She loosened it, not removed, loosened, converting to a pressure dressing, assessing reperfusion, and got a peripheral pulse back in the dorsalis pedis within 90 seconds. "Name?" Claire said, not looking up from the wound. "Walsh. Petty Officer Walsh." She got it out between clenched teeth. "Walsh. I'm Claire. Tell me when you feel pins and needles in your foot." "Nothing yet. It'll come. Stay with me." She finished the dressing, marked the time on the tape the way you marked it in the field. "The leg is fine. You're fine." She was already moving. Bed 4, a petty officer with 3rd-degree burns, covering both forearms and his left ear and jaw thermal injury from the blast. The kind that looked catastrophic, and sometimes was and sometimes wasn't. depending entirely on fluid management in the first hours. She started a large bore IV in the antecubital fossa, calculated Parkland formula in her head while she assessed burn surface area, set the fluid rate, and talked to him continuously because burn patients who went quiet were patients who were slipping somewhere unreachable, and she wasn't losing anyone to hypovolemic shock today. "Name?" she said. "Connolly." His voice was rough, the vocal cords irritated by heat and smoke. "Where are you from, Connolly?" "Pensacola." "I've never been." She checked the flow, checked his pressure, adjusted. "You're going to tell me if you feel cold or if your breathing changes." "I feel like garbage." "Garbage is great right now." "Garbage means you're talking to me." She moved her stethoscope to his chest. Deep breath. He tried. She listened. "Good enough," she said. "You're staying on my board." She moved to the next bay. She was assessing bed 6, a sailor, with diminished breath sounds, on the left, and a SPO 2 that had dropped from 94 to 91 in the 3 minutes since he'd been placed when Hale appeared at the entrance to the trauma area. He stood at the threshold in his white coat, with his badge and his title, and the full weight of institutional authority behind him, and looked at the room. 9 patients in various stages of critical management. Residents and junior nurses moving on Claire's instructions. Not because anyone had told them to, but because when everything is actively wrong, people orient toward whoever knows what to do. The room had organized itself around her, the way water organized itself around whatever was in its way. Hale looked at all of this. Then he looked at her. Navarro. He said it loud enough to reach her across 2 bays. She didn't stop. She had her stethoscope on the sailor in bed 6, and she was listening, cataloging, deciding. "Navarro, you are currently on administrative suspension. He's got a hemothorax developing," she said to Torres, who was directly behind her. "Get me a chest tube tray." Torres turned for the tray. "I am the senior physician on this floor," Hale said, walking toward her now, his voice tightening. "I'm instructing you to step back from these patients." She straightened and looked at him directly. The sailor's sat dropped to 89. She noted it in her peripheral vision. "Then step in," she said, and there was nothing hostile in it. It was an invitation, flat and genuine. "Walk me through your management of a developing hemothorax in a blast injury patient with oxygen saturation in the 80s and dropping." He looked at the patient. He looked at the monitors. He looked at the tray that Torres had set at the bedside. He looked at the 10 other people in the room, who were looking at him. He did not move forward. He did not speak. "Okay," Claire said. She reached for the tray. "I need you to step back, then." He stepped back. She didn't watch him do it. She was already working. The 10th patient arrived at the 48-minute mark. She knew it was different before the paramedics finished their handoff. She could tell by the way they moved that specific weight-bearing urgency of people transporting something that cannot be replaced. She could tell by the volume of blood on the field dressings and by the 2 naval security personnel who came through the ER entrance behind the gurney with their hands near their sidearms and their eyes moving across the room in the practiced, continuous sweep of people trained to assess threat and position simultaneously. The man on the gurney was large mid-40s, built for function rather than appearance, the kind of physical development that came from sustained operational use rather than a gym. He had a foreign object impaled in his right flank, a section of steel rod, 12 inches visible above the skin surface, the entry wound packed with field, dressing soaked completely through. His systolic was 86, his pulse was 124. His skin was pale and cool and damp. But his eyes were open and tracking her face as she approached. "Name?" she said. "Reyes." The voice was controlled, deliberate. "Marcus Reyes. Commander. Commander Reyes. I'm Claire. Tell me what happened." "Secondary structural collapse." Steel beam came down sideways. He was watching her assess him, the way trained people watched gauging her competence from her process, making decisions about how much to trust what she was about to tell him. My team. Are they? I have 9 of your people, she said. I'm focused on you. She was already mapping the wound. The angle of entry, the visible length, the direction of travel beneath the skin. She reached for the portable ultrasound. Without stepping back from the bedside, moved the probe to the skin beside the wound, watched the screen with the particular attention of someone looking for the one thing they most needed not to find. She found it. The tip of the rod was sitting 4 millimeters from the inferior vena cava. 4 millimeters. The distance between alive and dead in under 2 minutes if someone pulled that object without a vascular team already in position. Hale had come up behind her. She could feel him there. I'll manage this one, he said. She kept her eyes on the ultrasound screen. Look at the image. A beat. Then we need to get him to the OR and remove. Look at where the tip is, she said. Before you say remove. She heard his breath change when he saw it. Vascular surgery, she said, and her voice had the quality of someone issuing a command they expect to be followed immediately. Call them right now. Tell them impaled foreign object. 4 millimeters from the IVC. Patient needs the OR in 20 minutes, and they need a bypass team on standby. She looked at Reyes. His eyes were on her face. The rod stays exactly where it is until the OR is ready. Do you understand what I'm telling you? You can't pull it, he said. Not here. Not without the right team. In the OR, with the right setup, you'll be fine. She held his gaze. I need you to stay as still as you can. Don't tense. Don't shift your position. Just breathe. He was quiet for a moment, and she watched him process it, the situation, the constraint, the fact that his life right now depended entirely on not moving. Okay, he said. I'm going to be right here. She was already on the phone to Vascular, speaking in the clipped, precise language of someone who needed to convey a complex and clinical picture in 30 seconds and have it understood completely. She stabilized the rod with an improvised rigid brace fashioned from a trauma board segment and rolled gauze, keeping it immobile, protecting the 4 millimeters that were the only thing standing between Commander Reyes and catastrophic hemorrhage. She ran fluids. She managed his pain carefully, enough to keep him from tensing involuntarily, not enough to drop his pressure further. She talked to him every 2 minutes. Behind her, the ER doors opened. She heard the boots before she turned. She recognized the cadence, the hard, even rhythm of military-grade footwear on linoleum, not the random shuffle of visitors or the soft-soled quick step of medical staff, but something organized and purposeful and moving with the particular authority of people who were used to rooms reorganizing themselves upon their arrival. She turned. 4 naval security personnel in full dress fanned out slightly, hands visible. And behind them, a man in service dress whites with Admiral stars on his shoulder boards and a face that had been weathered into something that looked like patience, but was actually a much more demanding quality than that. He stopped inside the entrance to the trauma bay. His eyes went to Commander Reyes, stabilized and conscious with the rod braced in place. They moved across the board on the wall where 10 names were listed and status coded. They moved to the monitors, to the arranged bays, to the staff moving on the instructions of a nurse in blue scrubs who was standing in the center of all of it with a phone in one hand and a chart in the other. He took the room in. He took her in. And then Sandra Morse appeared from the corridor where she'd been watching from a careful distance, and her voice came sharp and immediate into this before the Admiral had finished his assessment. Thank God you're here. I need you to understand the situation. This woman is on active suspension from clinical duties issued this afternoon for repeated insubordination and unauthorized procedures. She has spent the last hour operating completely outside her authorized scope. Ma'am. The Admiral's voice was quiet, not loud. Quiet in the way that empty rooms are quiet, in the way that made everything else in the space become quieter too. I reviewed the security footage on the way over, both the hallway and the bay cameras. Sandra Morse stopped speaking. The room was very still. The Admiral's eyes moved back to Claire. He looked at her the way someone looked at a calculation they had already done but wanted to confirm. All 10 patients, he said. His voice was only for her. All 10 stable, she said. Commander Reyes needs the OR in the next 12 minutes. His vitals are holding, the object is secured, vascular has been notified, and is moving. She gave him the rundown, patient by patient, in 60-second status, intervention, current condition. Factual, no editorializing. He listened without expression. When she finished, he was silent for a moment that lasted long enough for every person in the room to understand that he was not a man who spoke before he was ready. I have been in 3 combat theaters, he said, not loudly. He said it to the room, to the board on the wall, to Sandra Morse, and to Kevin Hale, who had pressed himself against the far wall. I have seen forward surgical teams work mass casualty events in conditions that would make this room look like a classroom exercise. He paused. I know what controlled trauma management looks like. And I know what it looks like when someone who was never trained for it is doing it. He looked at Sandra. He looked at Hale. Then he looked back at Claire. What's your name, he said. Navarro? Navarro. What's your background, Miss Navarro? Army combat medic. 6 years. 2 deployments. She held his gaze. 4 years here. He nodded, once slow. On the counter 3 feet to her left, the suspension document sat where she'd placed it an hour ago, still folded along its center crease, completely ignored by every person in the room who had spent the last hour following her instructions. The OR coordinator's voice crackled over the intercom, confirming the vascular team was ready. They're ready for him, Claire said, and turned immediately to begin coordinating Reyes's transport. Because that was the next thing that needed to happen, and standing still wasn't something she had time for. Behind her, she heard the Admiral say one more thing. He said it quietly, but the ER was quiet enough now that it carried. Find out everything about her, he said to the aide at his shoulder. Everything. The aide didn't write anything down. He pulled out a phone and started moving his thumb across the screen. He was pulling a file that already existed, which meant the Admiral had asked about her before he walked through the door. Claire didn't have time to think about what that meant. The OR coordinator had confirmed the team was staged and ready, and moving Commander Reyes was a 12-step process that had exactly 0 margin for error. The rod had to stay immobile during transport, which meant the improvised brace she'd built needed to be secured to the gurney frame in a way that prevented any lateral shift when they rolled over the threshold between the trauma bay and the elevator corridor, which had a seam in the flooring that caught wheels wrong if you didn't know to angle the approach. She knew. She'd moved critically injured patients out of that bay 30 times. She walked beside the gurney and kept one gloved hand on the brace assembly the entire way to the elevator, not pressing, just present, monitoring for any vibration that felt wrong. Reyes watched her from the gurney. His color was worse than it had been 15 minutes ago. The sustained blood pressure drop was doing its quiet damage, but his eyes were still tracking, and his breathing hadn't changed pattern. You were Army, he said. It came out flat, not a question. 6 years, where? Places that didn't have names on the maps we were given. She watched the brace. Stop talking. Shallow breaths. I need to know if my XO made it. The man with the abdominal wound? She looked at him briefly. He's in surgery. He was stable when they took him up. Something in Reyes's face shifted, not relief exactly, more like a weight redistributing. He closed his eyes for 2 seconds, then opened them again. Okay, he said. Okay, she said. Now stop talking. The elevator doors opened. She walked him in, kept the gurney positioned, watched the floor numbers change. The vascular attending was waiting when the doors opened on 6, a compact, fast-moving woman named Doctor. Okafor, who had the specific energy of a surgeon, who had been interrupted mid-something and had instantly reprioritized without complaint. She looked at the ultrasound images Claire had printed and attached to the chart. looked at the brace assembly, looked at the rod. 4 millimeters, she said. Measured twice, Claire said. Angle of entry is about 17 degrees off vertical, trending toward the midline. He's been still since I braced it. Okafor looked at Reyes. Commander, I'm Dr. Okafor. I'm going to take care of this. She comes in, Reyes said. He meant Claire. She can't. She comes in, or we have a problem. Okafor looked at Claire with the expression of a person who did not have time for this particular complication. Claire shook her head slightly. Not her call, not her fight. She wasn't going to argue her way into an OR she didn't belong in. I'll be right outside, Claire said to Reyes. Doctor. Okafor is better at this part than I am. Let her do her job. He held her gaze for a moment. The way people held gaze when they were making a decision about trust that they didn't have enough information to make comfortably, but didn't have the luxury of deferring. All right, he said. She stepped back. The OR doors closed. She stood in the corridor outside and let out a breath she hadn't known she was holding. And then she went back downstairs because she had 9 other patients, and the night shift hadn't started yet, and the ER board was still full. The Admiral was still in the trauma bay when she returned. She hadn't expected that. Admirals came, they assessed, they made decisions, they left, they had staffs for the staying part. But he was standing at the edge of the room with his hands clasped behind his back, watching the organized activity of the ER post-surge the way he might watch a training exercise debrief, with a quality of attention that was evaluative rather than observational, like he was scoring something against a rubric she couldn't see. Sandra Morse was beside him, which told Claire the conversation had not gone well for Sandra, because if it had, Sandra would have been somewhere more comfortable by now. Claire went to check on Walsh, the tourniquet patient, from earlier, right leg, now elevated and reperfused and producing tingling in the foot exactly as Claire had told her it would. Walsh was 23, freckled, with the particular brand of exhausted alertness that came from an adrenaline crash hitting someone who was still trying to hold it together on principle. How's the feeling? Claire said. Pins and needles. It's bad. That's the circulation coming back. Bad is correct. Give it 20 minutes. She checked the dressing, checked the pulse, noted the color. You did good. Whoever put that tourniquet on you in the field did good. You kept pressure on it. Walsh was quiet for a second. Fotran put it on. Is he? Tran. Abdominal. Claire searched the board. He's in surgery. He was talking when they brought him in. She met Walsh's eyes. That's all I have right now. Walsh nodded, jaw tight. Don't look anything up on your phone, Claire said. Let the process work. Looking things up right now is only going to give you information you don't have the context to interpret. Is that medical advice? That's advice from someone who's watched people do it and make things worse for themselves. She adjusted the pillow under Walsh's leg. Rest. The pins and needles are a good sign. She moved to bed 4, to Connolly with the burns, who had been joined by a burn specialist from the floor above and was now receiving the kind of targeted care that Claire had been bridging toward for the last hour. She checked the chart, confirmed the fluid rate was matching her calculations, gave the burn specialist a 90-second handoff that covered everything relevant, and stepped back. She was standing at the nursing station writing notes when she felt someone beside her. She looked up. The Admiral had crossed the room. He was standing 2 feet away without his aide, without Sandra, without the 4 security personnel who were positioned near the entrance. Just him, in his whites, close enough that she could see the service ribbons in detail. You're still writing notes, he said. They still need to be written. He almost smiled. It was a small motion, more in the eyes than the mouth, the kind of thing you'd miss if you weren't paying attention. You have any idea who Commander Reyes is? He told me his name and rank. She kept writing. I didn't ask for more than that. It wasn't relevant to his treatment. He leads a classified maritime strike unit, 12-year operational record. 3 overseas rotations in theaters I can't name in a hospital corridor. The Admiral paused. He's also my daughter's husband. Claire stopped writing. She looked at him. His face had something in it now that hadn't been there before, not the evaluative quality of a senior officer assessing a situation, but something more personal and more unguarded. The face of a man who had walked into an emergency room not knowing whether someone he loved was alive. I didn't know that, she said. No, you didn't. He looked toward the elevator bank, though Reyes was 6 floors above them and invisible behind closed-door doors. I got the call when I was 20 minutes out from the base. They told me there was an explosion, mass casualties, and the hospital receiving was complicated. That's the word they used. Complicated. She waited. I pulled the camera feed from the ambulance bay and the trauma floor on the drive over. He looked back at her. I watched you work for 40 minutes before I walked in. Every patient, every decision. He paused again. I watched Hale stand against that wall. Sandra Morse was still across the room, talking to someone from the hospital's administrative office. Claire couldn't hear what was being said, but she could read the body language, and it was the body language of a person's being asked questions they didn't have good answers to. They suspended you, the Admiral said. It wasn't a question. Yes, sir, this afternoon. For saving a patient without waiting for a physician to authorize it. That's the documented reason. He was quiet for a moment. He looked at the suspension document on the counter beside her, still sitting where she'd left it, still folded along its center crease. He reached out and picked it up. He unfolded it and read it, the whole thing, taking his time. He folded it again and set it back down. Where were you deployed, he said. First rotation was Afghanistan. Second was a joint forward operating base, location classified. She met his eyes. I can't tell you more than that in a hospital corridor either. That almost smile again, fair enough. He looked at the room, at Torres managing the board, at the residents doing their work, at the shape of the ER returning to something like normal function after an hour of controlled chaos. You built a triage system in 30 minutes with whatever you had. You managed 10 critical patients simultaneously, 2 of whom required interventions that most attending physicians wouldn't have recognized on a timeline that fast. He paused. You did all of this while under administrative suspension in an institution that had spent the afternoon telling you your experience was irrelevant. She didn't say anything. There wasn't anything to say that the room hadn't already said for her. I'm going to ask you something, the Admiral said, and I want you to answer it the way you've done everything else today. Okay. Is there anything you did in the last 2 hours that you're not certain was correct? She thought about it, genuinely. The fluid rate on Connolly, I used a modified Parkland calculation because his burn distribution had an atypical pattern. I made a judgment call on the adjustment. I believe it was right, but Dr. Okafor's team should review it with fresh eyes. She paused. And I should have pushed harder on the OR timeline for Reyes. I had the ultrasound image at the 11-minute mark, and I spent 90 seconds trying to explain it to Hale before I went around him. I could have made that call faster. The Admiral looked at her for a long moment. 90 seconds, he said. He was close to the IVC. 90 seconds matters. Most people in your position would have led with what they did right. I know what I did right, she said. The other stuff is what I need to think about. He studied her face. Wait here, he said. He walked across the room toward Sandra Morse. Claire did not watch the conversation. She turned back to her notes, and she finished them because they needed to be finished, and because watching 2 administrators and an admiral figure out whose version of the last 6 hours was going to become. The official version was not something she could influence, and she had learned a long time ago not to spend energy on things she couldn't influence. She charted Connolly's fluid adjustments, documented Walsh's reperfusion assessment, noted the status of each of the 10 patients by name and bed number and current condition. She was finishing the last entry when Torres appeared at her shoulder. "How are you doing?" he said. She considered the question. Her lower back ached from moving in ways she didn't usually move. Her hands were steady, but her shoulders weren't. A low-grade tension that had been building since she'd walked back into the ER 2 hours ago. She had a headache starting behind her left eye that she'd been ignoring. "Fine," she said. "That's not actually an answer. It's the answer I have." She looked at him. Torres was 54, had been at Coastal Ridge for 18 years, had seen things in the ER that he never talked about outside the walls. He had 2 kids in college and a wife who ran a bakery, and he kept a small photo of his first grandchild tucked into the edge of his locker mirror. He was one of the steadiest people she had ever worked beside. "How's the board?" "Stabilizing. The 2 minor injuries from the first wave got discharged. Connolly's going up to the burn unit in an hour." He paused. "Walsh keeps asking about Tran. Tell her surgery is still going." "Which it is. She knows." He looked toward the elevator bank. "You hear anything from 6? Okafor is good. If she ran into something unexpected, she would have called down." "You sound certain." "I'm not certain. I'm choosing to act as if I am until I have information that changes that." She closed the chart. "It's a useful approach." Torres was quiet for a moment. "That Admiral hasn't left." "I know. He's been talking to Sandra for 20 minutes." "I know. Sandra looks like she's having a very bad time." "Torres, I'm just noting it. Note it somewhere else. I have charts." He made a sound that wasn't quite a laugh and moved back toward the board. Claire opened the next chart. She was 3 lines into it when the elevator chimed. Dr. Okafor came out of the elevator at a walk, which was the right speed, not the run, that meant something had gone catastrophically wrong, not the slow drift of someone who was processing a loss. A walk. She had her oar cap still on, and she was looking for something, scanning the floor, and when her eyes found Claire, she changed direction without breaking stride. "He's out," she said. "IVC intact. We got the rod free without any tear. He lost about 800 cc intraoperatively, which was within the range we planned for." She paused, and something crossed her face, professional satisfaction, mixed with something more personal, the specific expression of a surgeon who had gone into a case knowing exactly what could go wrong and had come out the other side. "Your brace held the entire time. Not a millimeter of movement." Claire let out a breath. "He's going to recovery now," Okafor continued. "ICU admission after, just for monitoring, but I'd expect him to clear within 48 hours if there are no complications." She looked at Claire for a moment with an expression that was difficult to read. "You bought him that surgery with how you managed him downstairs. The brace, the pressure management, keeping him still. If that object had shifted 3 millimeters in either direction before we got him opened." She didn't finish the sentence. "It didn't," Claire said. "No, it didn't." Okafor pulled off her oar cap. "I'm going to find the Admiral and brief him. He's near the nursing station." Okafor nodded and crossed the floor. Claire stood where she was for a moment. The ER noise continued around her monitors. Voices, a phone, ringing, the distant sound of an ambulance on the street outside. Normal sounds. The sounds of the place working the way it always worked, patient by patient, and problem by problem, and decision by decision, grinding forward. Her hands were shaking. She noticed it, the way she noticed things matter-of-factly, without drama. She pressed both palms flat on the counter for 5 seconds, felt the solid surface under them, and the shaking stopped. Or she stopped noticing it. It didn't matter which. She went back to the chart, the conversation between the Admiral and Doctor. Okafor lasted 4 minutes. Claire tracked it from her peripheral vision, not eavesdropping, just orienting, the same automatic awareness she maintained of everything in the room. She saw Sandra Morse drift closer to them, probably to insert herself into whatever was being decided. She saw Hale, who had migrated from the far wall to a position near the attending physician area, and was doing a reasonable impression of someone who had been there all along doing important things. She had been watching Hale for the last hour when she had time to watch him. He had done 3 things in that time. He had given one instruction to a resident that was medically correct, but 2 minutes late, he had approved a medication order that Torres had already called in, and he had stood near the entrance of the bay where Commander Reyes had been stabilized and watched the empty space where the gurney had been, with an expression she couldn't entirely read. She thought she understood it. She wasn't sure she wanted to. The hard thing to watch was how the residents had reorganized. In the first 20 minutes after the casualties arrived, they had looked at Hale for direction. When he hadn't given any, they had looked at Claire. And then they had stopped looking at Hale entirely, not out of disrespect, or not only out of that, but because the room had a gravity, and the gravity had a source, and redirecting toward it was simply the most efficient thing to do when patients were dying. The residents were smart. They had adapted. They would have to carry that adaptation forward. Whatever came next, and that was going to be an uncomfortable thing for this department to process in the days ahead. She was thinking about that, about the aftermath, about the reckoning that happened after emergencies when everyone had to look at what they'd done and what they hadn't done when the Admiral's aide appeared at her side. The Admiral would like a word, he said. She set down the chart and crossed the room. They were standing away from the main desk, in the short corridor that led toward the family waiting area, enough distance from the activity of the ER floor to have a conversation that wasn't going to be overheard by everyone within 20 feet. The Admiral, Dr. Okafor, and Sandra Morse. No Hale. That was notable. Sandra's face had an unfamiliar quality, the precise controlled blankness of someone who had been told something they disagreed with deeply and had made the calculation that there was no productive avenue for expressing that disagreement at the present moment. The Admiral looked at Claire when she arrived. He looked at her the way he'd been looking at her since he walked in, with the evaluative attention of someone taking real stock. Dr. Okafor has briefed me on Commander Reyes, he said. She's also given me her assessment of the improvised stabilization. I had the materials I had, Claire said. Yes. He glanced at Sandra. Ms. Morse has explained the circumstances of your suspension today. Claire waited. She's also explained the incident from this morning that prompted it. He paused. The petty officer whose tension pneumothorax you decompressed without waiting for physician authorization. Ramos, Claire said. He's probably been discharged by now. He has. I spoke to him an hour ago. He let that land. He's aware of what happened. Sandra made a small movement, not quite a flinch, but adjacent to one. I want to understand something, the Admiral said. When you picked up that needle this morning, when you decided not to wait for Dr. Patel to act what was going through your head, it was a genuine question. She could tell the difference. I've seen that presentation before, she said. On a forward operating base, in a place where we had no physician on site, and the nearest surgical capability was 40 minutes by air. I've seen what it looks like when someone with tension pneumothorax goes to arrest because the decision was delayed. I've seen what it looks like when you get there in time. She paused. This morning I got there in time. The outcome was the only variable I could control. And the risk to yourself, your license, your position? I considered it, she said, briefly, and the man in front of me was dying. The Admiral was quiet. Sandra said, Admiral, I understand that today's events were extraordinary, but the institutional framework. Ms. Morse. His voice was still quiet. It was always quiet. I'm going to stop you there. Sandra stopped. I've reviewed 14 hours of security footage from this facility in the last 2 hours. He said it without inflection, which somehow made it worse. I've reviewed this morning's incident report, the suspension documentation, and Commander Reyes's transport records. I've also had my staff pull the personnel file for every person on this floor today. He looked at Sandra with the expression of someone who has gathered all the information they need and has moved past the stage of gathering into the stage of concluding. I have a clear picture. Sandra's jaw was tight. The suspension is voided, he said, effective immediately. Admiral, with respect, that is a hospital governance matter, and not within the jurisdictions. The 10 casualties admitted to this facility tonight are active duty naval personnel involved in a classified military operation, he said. Their care falls under federal medical oversight. I have both the authority and the obligation to ensure that authority was competently exercised. He paused. It was not exercised by the people whose job it was to exercise it. It was exercised by professionally. It was exercised by Ms. Navarro. He looked at the suspension document which Sandra had apparently retrieved from the counter at some point, because it was in her hand. Void it. The silence in the corridor had a specific texture. Sandra looked at the document. She looked at the Admiral. She looked at Claire with an expression that was complex in ways Claire didn't have the energy to parse right now, something in there that was close to anger, and something underneath the anger that might, at a long distance, have been shame. She held out the document. Tear it, the Admiral said. Sandra tore it, not cleanly. The paper caught and ripped unevenly, and she had to do it twice to get through the whole sheet. The pieces went into the waste bin by the wall. Doctor. Okafor, the Admiral said. Sir, you'll have a full debrief request from my office tomorrow morning regarding the management of Commander Reyes and the other 9 casualties. I'd like a complete accounting of every intervention, decision, and timeline. Of course, Ms. Navarro. He turned to her fully. Sir, you're reinstated, full duties, effective now. He held her gaze. But I need you to understand that what happened today is not finished. There are going to be questions from the hospital board, from Naval Command, from several other people who have an interest in what a classified training exercise just turned into in a civilian ER. He paused. I'm going to need you available. I'm not going anywhere, she said. He nodded. Something in his expression shifted the evaluative quality, softening into something she didn't have a clean word for, the expression of a man who had spent a long career building, a picture of what competence looked like under pressure and had just been shown something that matched the picture exactly, unexpectedly, in a place he hadn't thought to look for it. No, he said. I don't think you are. He turned to go. Admiral. The word came out before she'd decided to say it. He stopped. Reyes asked about his XO when we were moving him. The man with the abdominal wound. Petty officer, I don't have a last name. He came in as a John Doe while his ID was being processed. Warrant Officer Decker, the Admiral said. He was in surgery when I last checked. I don't have an update. He was quiet for a moment. Something crossed his face that was not the Admiral's face. Something older and more tired, the face of a man who had sent people into harm's way and had spent decades reconciling that with whatever's he was otherwise. I'll find out, he said. He walked back toward the ER floor. Claire stood in the corridor for a moment, by herself. The fluorescent light above her had a flicker she'd reported twice in 2 years, and that had never been fixed. The linoleum was scuffed near the baseboard, where gurneys had clipped it too many times. Down the hall, the ER made its noise, patient after problem after problem, the same way it always did. She went back to work. The night shift came on at 7 p.m., and the incoming nurses took their patients, and Claire gave handoffs that were thorough and fast and complete. Walsh was sleeping when Claire left her bay, leg elevated, tourniquet gone, the long dark bruise of reperfusion spreading across her thigh in the pattern that meant the circulation had done what it was supposed to do. Connolly had been moved upstairs to the burn unit an hour ago. The others were distributed across the floors, each one alive, each one a problem that had been solved. She was at her locker, pulling out her bag, when Torres found her. Hale left, he said, 20 minutes ago. His assistant came for his bag. Okay. He didn't say anything to anyone on the way out. Okay. Torres leaned against the locker next to hers. You know the board is going to convene. The hospital's lawyers are already in the building. I saw them on their way to the administrative suite. I know. Sandra's been in her office with the door closed since the Admiral left. Torres. She looked at him. What are you actually trying to tell me? He thought about it. I think I'm trying to tell you that this isn't over, and that you should be prepared for it to get messier before it gets cleaner. She pulled her jacket on. I know that too. And I think he stopped. What? He looked at her with the expression of someone choosing words carefully, the way you chose words when you wanted to say something true without sounding like you were making a speech. I've worked with a lot of nurses, a lot of good ones. I've never watched someone do what you did today and make it look like just doing the job. She looked at him. It was just the job, she said. It's the only way I know to do it. He nodded, the small nod of someone who understood that this was the truest possible answer and also, somehow, the most remarkable one. She closed her locker. She slung her bag over her shoulder. She was almost at the door, to the parking corridor, when her phone rang. She looked at the screen. Unknown number. Military exchange prefix. She recognized the format from 6 years of seeing it. She answered, Ms. Navarro. The voice on the other end was not the Admiral's. It was a woman's voice, precise and unhurried, the voice of someone who spent their days in rooms where decisions had large consequences. My name is Colonel Diane Farrow. I'm calling on behalf of the Department of Defense Special Operations Medical Command. Admiral Blackwell has forwarded your personnel file and his written assessment of tonight's events to our office. A pause, brief and pointed. We'd like to schedule a meeting. Claire stood in the corridor, with the door to the parking lot propped open by her foot and the cold night air coming in against her face. What kind of meeting? She said. The kind, Farrow said, that tends to change the direction of a career. Claire stood in the parking corridor for 3 seconds after Farrow hung up, phone still at her ear, the dead line producing nothing but the faint electronic hiss of a disconnected call. Then she put the phone in her pocket and pushed through the door into the cold. The parking lot was mostly empty at this hour, lit by overhead lamps that turned everything a flat sodium yellow. Her car was at the far end near the fence, where she always parked, the longest parked because it was the longest walk, and she'd learned years ago that the walk in and out of a shift was the only unstructured time she reliably got. Tonight, she stood beside the car for a moment without unlocking it, looking at the column of smoke that was still faintly visible against the dark sky in the direction of the naval complex. Thinner now but present. The last evidence of whatever had happened out there, still dissipating into the atmosphere. A meeting, the kind that changed the direction of a career. She turned that over, let it sit, didn't reach a conclusion about it, because reaching a conclusion about it tonight, on this data, with this level of exhaustion, would be a waste of energy. She'd learned that too. Not every problem needed to be solved in the parking lot at 7:30 at night. Some problems needed sleep and then a second look. She drove home. The apartment was the kind of place that looked temporary, even after 4 years of living in it, not neglected, but undecorated. The walls still the same rental white they'd been when she moved in. The furniture practical and mismatched. A bookshelf full of medical texts and field manuals arranged by how often she used them, rather than any system a visitor would understand. She had a photograph on the windowsill of herself and 3 other people in DCUs in front of a vehicle. She couldn't identify in the background without knowing what to look for. She knew what to look for. She almost never looked at it. She showered. She ate something leftover rice and vegetables from 2 days ago, cold, standing at the kitchen counter because sitting down had a gravitational pull toward staying down that she wasn't ready to test. She looked at the phone twice. Farrow hadn't called back with any details. The Admiral's office hadn't sent anything. She checked her work email, found nothing unusual, closed it. She went to bed at 9:15 and stared at the ceiling for 11 minutes before she fell asleep. The call from Colonel Farrow came again at 7:45 the next morning. This time she had a location and a time, a federal building in downtown Bellport, conference room on the 4th floor, 1,300 hours. She was to bring any professional documentation she wanted to reference. She was not required to bring legal representation. but she was not prohibited from doing so either. Claire wrote down the address, confirmed the time, and went to the hospital for her morning shift because she was still scheduled and the board wouldn't run itself. The ER, quieter than yesterday, dramatically quieted her. The hollow, overlit quiet of a trauma floor that had expended everything it had and was now rebuilding its inventory. Torres was already there when she arrived. Same time as always, coffee in his hand, and the same patient board in front of him that he'd been managing for 18 years. "How are you doing?" he said. Same question as the night before. "Same answer as last time," she said. "Hale didn't come in this morning." She looked at the board. "Who's covering?" "Dr. Vasquez from Vascular agreed to attend until administration figures something out. She's not thrilled about it." "She's good. She is." "Also not thrilled." He paused. "There are 2 men from the hospital's legal department waiting in the administrative suite. They've been there since 7. "Are they waiting for me?" "I don't know who they're waiting for. I just know they're there, and they look like they haven't slept." She pulled on her gloves and went to work. The morning ran in that particular way. That post-surge mornings ran. The acuity was lower, but the administrative pressure was higher. The hall full of people who wanted to debrief and document and assign narrative to what had happened yesterday, while the medical staff was still simply trying to manage today. Claire saw 6 patients before 10 o'clock, none of them critical, all of them requiring the same quality of attention as the critical ones, because the non-critical ones were also people who needed her to pay attention. She was finishing a wound check in Bay 2 when a young woman appeared at the curtain edge. Early 20s, short, with the upright carriage of someone recently out of uniform and not yet entirely comfortable in civilian posture. She had a visitor badge clipped to her jacket. "Ms. Navarro?" Claire looked up. "That's me. My name is Petty Officer Walsh. We met yesterday." She hesitated. "I mean, I know we met. I just wanted to—" She stopped. She looked like she was trying to find a sentence and kept finding different ones. "I wanted to say thank you." Claire finished the wound dressing and stepped away from the patient's bed. "You didn't have to come back in for that." "I know." Walsh looked at her hands. "They told me this morning that Decker made it." "Warrant Officer Decker." "My XO." She looked up. "They said he was touch and go for a while in surgery, but he's stable." "That's good news." "Yeah." Walsh's voice had the particular roughness of someone who had been holding something tightly for a long time and had only just released the pressure. I heard some of what happened. With the administration. The suspension." She met Claire's eyes. "Is that actually true? They actually suspended you for saving Ramos, and then you came back anyway when the explosion happened? It's more complicated than that." "Is it?" Claire looked at her for a moment. Walsh was standing with her hands in her jacket pockets and her chin level and her eyes steady, the stance of someone who had learned to occupy space without apology. "Not really," Claire said. Walsh made a sound that was half law and half something else. "Well." She reached out and briefly, awkwardly, touched Claire's forearm, the gesture of someone who wanted to say something physical that words weren't covering. "Thank you. That's all." She left. Claire watched her go, then turned back to the chart. By noon, the 2 lawyers from the hospital's legal department had materialized on the ER floor, which was unusual enough that it stopped 2 nurses mid-conversation when they walked in. They found Claire at the nursing station and asked if she had time for a brief conversation. "I have a patient in Bay 4, she said. "It's brief," said the one on the left. "His name tag," said Gerhardt. He had the careful, pressed energy of someone who billed in 6-minute increments. "Then come back in 10 minutes, she said, and went to Bay 4. When she came back, they were still there. They found a corner near the family consultation room. Gerhardt did most of the talking, his colleague taking notes on a yellow legal pad. The hospital's board had convened an emergency session that morning, he told her. They were conducting a full review, professionally, of the events of the previous afternoon, both the management of the mass casualty incident and the circumstances surrounding her suspension. They wanted to make sure she understood that she was not the subject of any adverse action at this time. I know, she said. The suspension was voided last night. Yes. By Admiral Blackwell's directive. The board is currently determining whether that directive falls within federal authority regarding the care of military personnel on civilian premises. He paused. It's a complex jurisdictional question. Is it being contested? Gerhardt and his colleague exchanged a look that lasted 1 second too long to be meaningless. There are competing perspectives on the appropriate process, he said. The board wants to ensure that any personnel actions at this facility are processed through proper institutional governance. Claire looked at him. Are you telling me they're considering reinstating the suspension? I'm telling you the board is in session and the situation is being evaluated. He said it with the smooth, pressurized evenness of a man who had been trained to say things that meant specific things without appearing to mean them. We're simply making sure you're aware of the process and your rights within it. She looked at the yellow legal pad in the Saxon lawyer's hand. She looked at the door of the consultation room. She thought about a meeting at 1,300 hours in a federal building downtown. Thank you, she said, for the information. She walked back to the nursing station and pulled up the next chart. At 1,215, she changed out of her scrubs in the locker room, put on the cleanest clothes she kept in her bag for the rare occasions when she needed to look like someone who owned more than 3 sets of work clothes, and drove downtown. The federal building was a gray concrete structure on Meridian Street that had been built during a period of municipal architecture when the prevailing philosophy was that public should communicate permanence through the aggressive elimination of anything resembling warmth. The lobby had 2 security checkpoints, a metal detector, and a guard who found her name on a list and listened and issued her a badge without making eye contact. The 4th floor conference room had windows that looked out over the Bellport waterfront. On a clear day, you could probably see the naval complex from up here. Today there was still a faint haze in that direction from yesterday's smoke. Colonel Diane Farrow was already in the room when Claire arrived. She was 53, compact and deliberate in her movements, with gray coming through at her temples and the kind of face that had been trained to reveal information only on purpose. She wore service dress and had a single manila folder on the table in front of her, closed. There was a second person in the room, a man Claire didn't recognize, civilian clothes, no introduction offered, positioned slightly away from the table with a tablet in his hand. Miss Navarro. Farrow gestured to the chair across from her. Thank you for coming, Colonel. Claire sat. Admiral Blackwell sends his regrets. He's in a classified briefing this morning related to yesterday's incident. He asked me to convey that he'll be in contact directly. She placed one hand flat on the folder. I want to be transparent about the purpose of this conversation. We're not here to evaluate what happened in the ER last night. The Admiral's assessment is thorough, and his conclusions are not in question at our level. She paused. We're here because of what it implies. Claire waited. The DoD, Special Operations Medical Command, has a persistent problem, Farrow said. Elite units deploy into environments where conventional trauma care protocols are not applicable. The gap between what field medics can do and what the casualty actually requires has cost lives not from a lack of courage or effort, but from a gap in training methodology. We've been building a new program for the past 18 months. She opened the folder. We need someone to run the clinical curriculum. On the folder's top page was Claire's name, her Army service record, her nursing credentials, and a paragraph of assessment notes in a handwriting Claire didn't recognize, but that was clearly written just like someone who had watched her work. Run it, Claire said. What does that mean exactly? It means you design the training scenarios. You establish the clinical standards, you instruct the medic candidates, and you evaluate their performance against criteria you set. It means your experience translates directly into a structure that other people can learn from. Farrow paused. It's a commissioned appointment. Major, you'd be reinstated into the military framework under a reserve commission with active duty responsibilities for the duration of the program. Claire looked at the folder. I have a job, she said, at a hospital that spent yesterday afternoon trying to suspend you for saving a patient's life, like Farrow said, and her voice didn't change pitch or character when she said it, which somehow made it more pointed than if she'd said it with heat. And that, as of this morning, may be considering whether to reinstate that suspension through an internal process that would effectively override a federal directive. Claire looked up. Farrow's expression confirmed it without elaboration. The lawyers, Claire said. Institutional self-preservation has a predictable shape, Farrow said. We've seen this before. The man with the tablet shifted slightly, but still didn't speak. Claire noted it. I'm not going to make a decision in a conference room at 1 in the afternoon. Claire said, not about this. I'm not asking you to. Farrow slid the folder across the table. Take it. Read it. Think about it. She held Claire's gaze. But I want you to understand what you'd be walking back into at Coastal Ridge while you're thinking. And I want you to understand what you'd be walking toward. Claire picked up the folder. She drove back to the hospital at 1420, folder on the passenger seat, thinking about the specific difference between what she was good at and what she was supposed to be doing, and whether those two things were finally, 4 years late, about to stop being different. The ER was running at normal volume when she came back through the post-surge quiet had broken, and the afternoon was filling up with its usual load, the board ticking over with new names and new problems. Torres looked up when she came in, read her face with the efficiency of a man who had been reading people's faces in emergencies for nearly 2 decades, and didn't ask. She was 3 steps from the nursing station when Sandra Morse appeared, the direction of the administrative corridor. Sandra had changed clothes since last night. She had her reading glasses on and her lanyard and her folder, all the equipment of institutional authority, reassembled. She had the expression of someone who had spent the morning making a decision they didn't like and had arrived at the implementation phase. Ms. Navarro, she stopped. I need a moment. I'm on shift. This will be brief. Sandra looked at Torres, then back at Claire. In my office. Something in Sandra's posture had changed from last night. The controlled blankness was still there. But beneath it was something harder, something that had been worked into a point since the Admiral's directive had come down. Claire recognized it. She had seen it in other contexts, in other people, the expression of someone who had decided that a tactical retreat was not the same as a surrender. The office was small and precisely organized, the kind of organization that asks pressed control through the arrangement of objects. Sandra sat behind her desk. She did not offer Claire the chair across from it. The hospital board met in emergency session this morning, Sandra said. They've completed their preliminary review of yesterday's events. I know. Your legal team spoke to me this morning. Then you understand that the board has concerns about the manner in which yesterday's personnel decisions were handled. Specifically, she chose the next words, with care the manner in which an external authority intervened in what is properly an internal matter of clinical governance. The Admiral voided the suspension because 10 military casualties were managed by the person you'd suspended, Claire said. That's not a complex jurisdictional question. That's cause and effect. The board disagrees. Sandra held her gaze. Admiral Blackwell has significant authority within the naval command structure. He does not have unilateral authority to override institutional personnel actions at a civilian facility unless federal law specifically provides for it, which, in this case, is he contesting his own directive, Claire said. He is in a classified briefing, so someone else is contesting it on his behalf. Sandra was quiet for 2 seconds, which was its own answer. The board, Claire said, is trying to reinstate the suspension. The board is trying to ensure that proper process is followed. Sandra's voice had a quality Claire associated with people who had practiced a speech. That includes a formal review of your actions both this morning, the Ramos incident, and during the mass casualty event. Until that review is complete, the board feels it is appropriate to minus. The office door opened. Neither of them had knocked or been buzzed. It opened with the authority of someone who had not considered that the door might be closed to them. Admiral Blackwell walked in. He was not in service dress. He was in working uniform, the utility version, no stars on his collar, a different quality of presence than last night's, less ceremonial and more direct. Behind him was the same aide from last night, and behind the aide was a woman in a dark jacket with a federal law enforcement ID clipped to her lapel. Sandra stood up. Admiral. Her voice had gone careful in a way that hadn't been there a moment ago. Ms. Morse. He looked at her, then at Claire, then back at her, with the specific quality of a man who had just confirmed something he'd suspected. The briefing was shorter than expected. He pulled a chair than expected, pulled a chair from the corner and sat in it without being invited to, in the way that people sat in chairs when the question of invitation had not occurred to them. You were discussing the board's review. I was informing Ms. Navarro of the board's preliminary findings. The review is suspended, he said. Sandra's expression fractured, barely, along a seam Claire wouldn't have seen if she hadn't been watching closely. Admiral, I've explained the jurisdiction. The Uniform Code of Military Justice has a provision regarding civilian medical facilities that receive military casualties under mass casualty designations, he said. That provision was activated last night when Coastal Ridge was designated primary receive for the Bellport explosion. Under that activation, federal oversight of all casualty management decisions, including personnel decisions that directly affected the quality of care those casualties received, falls to the relevant military command authority. He paused. That's me. Sandra looked at the woman with the federal ID. Special Agent Kowalski, DD Inspector General, the woman said. It was the first thing she'd said. She said it the way people stated facts that had legal weight. The silence in the office had a texture like pressure. The Inspector General's office opened an inquiry this morning, the Admiral said, into the circumstances of Ms. Navarro's suspension, the management of the mass casualty event, and the subsequent attempt by this institution to reinstate a suspension that federal authority had voided. He looked at Sandra. He looked at her the way he'd looked at the trauma bay last night, not with anger, but with the settled, clear-eyed attention of someone who had gathered all the relevant information and was simply reporting his conclusions. That inquiry will be comprehensive. It will include the camera footage, the medical records, the incident reports, the board session notes from this morning, and any communications related to today's personnel discussions. Sandra sat back down. It was not a choice, exactly. It was more like a structural failure, gradual, and then complete. Miss Navarro, the Admiral said. Claire had been standing axis of the wall, slightly out of the main axis of the room, watching all of this with the still present attention she brought to situations where her job was to observe rather than act. Sir, you should know that Warrant Officer Decker was upgraded to stable this morning. He'll be out of the ICU within 48 hours. He paused. Commander Reyes is asking for you. She blinked. For me. He came out of the ICU at 900. His wife, my daughter, was with him this morning. He's been asking to speak with the nurse who managed him in the ER. The Admiral's expression said something in it she hadn't seen before, something quieter and more personal. He's particular about things. He doesn't make requests casually. I'll go up, she said. Before you do. He reached into the front breast pocket of his utility jacket and produced a folded document, not the kind from hospital administration, not the clean white paper of a personnel action. A government document with a military letterhead and a seal she recognized from the folder Farrow had given her 2 hours ago. I understand you met with Colonel Farrow this afternoon. Yes, sir. She gave you the program overview. She did. He held out the document. This is the formal appointment letter. Major, Reserve Commission, active duty assignment, to the Special Operations Medical Command Tactical Trauma Training Program. He held her gaze. It requires your signature. It also requires you to make a decision about where you want to be. She looked at the document. She thought about the folder on her passenger seat. She thought about Gerhardt with his yellow legal pad and his jurisdictional complexity. She thought about Walsh's hand on her forearm and Connolly asking about Pensacola and Reyes's tracking her face while she told him the rod had to stay. She thought about a conference room in this hospital where two people had told her that her experience was irrelevant and her instincts were a liability. She reached out and took the document. She did not sign it. Not yet. I need to go see Commander Reyes, she said. The Admiral nodded. She walked to the door, past Special Agent Kowalski, past the aide, and into the corridor. Behind her, she heard the Admiral begin speaking again, his voice quiet and level, and she did not hear what he said to Sandra Morse because she was already moving toward the elevator. The ICU on 6 was quieter than the ER, in the way that all ICUs were quieter, the same density of monitoring equipment, but a different quality of stillness. The stillness of people who had passed the immediate crisis and were now in the long, unglamorous work of recovery. She found his room third from the end of the corridor. The curtain was partially open. Reyes was in the bed, with the incision site dressed under his gown and 2 IV lines still running, and the particular careful stillness of a man with a fresh abdominal wound who had learned exactly how to hold himself to minimize the pull on the closure. He looked worse than he had last night, in the way that post-operative patients always looked worse. The adrenaline was gone. The body had stopped running on emergency reserves. And what was left was the actual cost of what it had been through. His color was better, though. His eyes were clear. There was a woman in the chair beside the bed, late 30s, dark-haired, posed in the way of someone who had been sitting in hospital chairs beside people she loved for enough of her life to have learned how to do it without coming apart. She looked up when Claire entered with an expression that was cautious and assessing, and something else underneath. Something that looked like the specific exhaustion of someone who had arrived at the hospital the night before, not knowing whether the person in the bed would be alive. "You're the nurse?" she said. "Claire Navarro." The woman stood and held out her hand. "Julia Reyes." She held Claire's hand a beat longer than a standard handshake. "He hasn't stopped asking about you since he came out of recovery." "I told her to stop fussing," Reyes said from the bed. His voice was rough from the intubation, but steady. "You didn't tell me anything. You asked for her 4 times. That's not fussing. That's information gathering." He looked at Claire. "Come in." She came in. She stood at the bedside and looked at the monitors, the chart, the dressing, the lines, not because she needed to. She wasn't his nurse on this floor, but because looking at a patient was how she oriented to a patient, and she couldn't entirely turn that off. "How are you feeling?" she said. "Like someone drove a steel rod into me." He looked at her steadily. The surgeon said 4 millimeters. Approximately. He was quiet for a moment. "I've been briefed on what happened in the ER last night. All of it. The suspension, the Admiral, the whole situation." His jaw tightened slightly, not from pain. "They suspended you for saving a man's life, and then they tried to keep you out of the ER when my people came in. It's more complicated, is it?" He said it the same way Walsh had said it. She stopped. "I've been in the military for 16 years, he said. "I know what institutional obstruction looks like when it's dressed up in governance language. I've watched it cost people." He held her gaze. "My XO is alive. Walsh is going to keep her leg. Connolly is going to..." He stopped and took a breath that was careful and measured. 9 other people are alive because you walked back in through those doors with a suspension notice in your pocket." He paused. "I wanted to say that to your face." The room was quiet. "It was the job," she said. "No." He shook his head, small and deliberate. "It was more than that, and you know it. Don't minimize it." She looked at him. He was watching her with the particular particular attention of someone who had career evaluating people under pressure and had formed conclusions about her that he was now confirming in person. My father-in-law told me about the appointment, he said. The training program. He moved fast. He always does. Something crossed Reyes's face affection, complicated. The expression of a man who had a real and specific relationship with the Admiral, rather than an institutional one. He's not wrong about you. I watched what you did in that bay. The brace, the ultrasound, the way you talked me through it. That's not nursing school. That's a different kind of training. It's both, she said. Yeah. He nodded. It is. He looked at the window, the gray sky beyond it. I've lost medics in the field because they didn't have the right framework for the injuries they were seeing. Good people, well trained by any conventional metric. But the gap between what they'd learned and what they needed to know in the moment was, he stopped. I think you understand that gap better than most people alive. She understood it. She understood it, specifically, with faces attached. There's a problem, she said. He looked back at her. The hospital board is trying to contest the federal oversight claim. There's an IG inquiry opening, which should resolve it, but the legal process is. I know, he said. The Admiral briefed me 20 minutes ago. He reached for the water cup on his tray, drank, set it back, with the careful precision of a man managing pain. It's going to get worse before it resolves. They're going to push back. There are people on that board who have institutional reputations tied to the decisions they made yesterday, and they're going to protect those reputations aggressively. He looked at her. Are you ready for that? It was a real question. She took it seriously. I don't know, she said. He looked at her for a moment. That's the most honest answer you could have given. He settled back against the pillow. The Admiral is going to ask you to go on record. Formal deposition, everything documented. It will be used in the IG proceeding. I know. It will also be very public. I know that too. They're going to come after your record. Every decision you've made here in 4 years, every incident report, every deviation from protocol, every judgment call. He held her gaze. They'll find something. They always find something. She thought about the parkland calculation she'd questioned herself on. She thought about the 90 seconds she'd spent explaining the ultrasound to Hale instead of going around him immediately. She thought about the 37 other moments in 4 years when she'd made a call that she'd second-guessed in the dark afterward. I know, she said. He was quiet for a moment. Then, what are you going to do? She looked at the appointment letter, still folded in her hand, the document she'd been holding since the Admiral's office. She looked at Reyes in the bed, recovering. She looked at the monitors, showing his vitals stable, trending better, the numbers of a man who was going to be fine. She looked at the door. She should have seen it coming. She had been in the field long enough to understand that the moment before something went wrong had a texture, a quality of stillness that preceded the break. She had felt it 100 times. She felt it now, standing in the ICU doorway, the appointment letter in her hand, the IG inquiry somewhere below her, being organized into a structure that would determine what happened next. She felt it, and then her phone rang. Torres, she answered. You need to come down, he said. His voice had a quality she had never heard in it before, not in 4 years of working beside him. Hesestion, seen, not alarm something past alarm, something that had already processed the alarm and arrived at something colder on the other side. What happened? Hale called a press conference, Torres said. 30 minutes ago, it aired on the local news. He's claiming you falsified your military records to gain employment. He's claiming the interventions you performed last night were unauthorized and dangerous. A pause. He's claiming that Reyes's near miss on the Vena Cava wasn't because of how you found it. He's claiming it was because of something you did. The floor felt solid under her feet. She focused on that. He's claiming you caused the injury, Torres said. The phone was still at her ear when Reyes spoke. Go, he said. He'd read it on her face before she'd processed it herself. She was already moving. The elevator took 40 seconds, and she spent them reading the local news station's website on her phone, finding the clip Torres had referenced. Hale was standing at a podium outside the hospital's main entrance, not the ER entrance, the main entrance, with the Coastal Ridge Medical Center sign visible in the background, which meant someone had planned this carefully enough to pick a backdrop. He was in his white coat. He had his badge. He looked like the senior physician he was, which was the point. The clip was 4 minutes long. She watched 90 seconds of it in the elevator. Hale spoke with the measured gravity of someone who had rehearsed the tone, if not the exact words. Concerned, reluctant, a man compelled by professional obligation to raise uncomfortable questions. He said that in the aftermath of a traumatic mass casualty event, it was important that the public understood what had actually occurred at Coastal Ridge Medical Center. He said that a nurse had performed procedures outside her scope of practice. He said that her military record, which she had used to justify those procedures, contained discrepancies that the hospital was now investigating. He said that one of the casualties he did not name Reyes, but the description was specific enough, had sustained a complication during his time in the ER that required emergency vascular intervention, and that the nature of that complication was still being reviewed. He did not say the words falsified, dangerous, or caused directly and cleanly. He said enough adjacent words that the meaning assembled itself in the listener's mind without him having to be accountable for the assembly. The elevator opened. Claire put the phone in her pocket. Torres was waiting 10 feet from the elevator bank. "How many outlets picked it up?" she said. 3 local stations. 1 regional wire service. He fell into step beside her. "It's been running for 20 minutes. The hospital's communications office has been calling the floor, asking if anyone has spoken to media." "Have they?" "No." She went to the nursing station and pulled up the security footage archive on the internal system, not the camera feeds the Admiral had reviewed, but the specific bay cameras that covered the trauma floor. She had access because she was on the clinical staff, and the footage was part of the medical record chain for the mass casualty event, which meant it had been formally preserved as evidence the moment the IG inquiry opened. She found timestamps she needed the moment she had placed the ultrasound probe beside Reyes's impalement wound. She played it forward. The angle wasn't perfect. The bay camera was mounted high and angled for overview coverage, not procedural detail. But it was clear enough. It showed her approach to the gurney, the probe placement, the positioning of her hands, both hands, visible, neither of them in contact with the steel rod. It showed Hale arriving at her shoulder. It showed the moment she turned the screen toward him. It showed her calling vascular on the phone, while the rod remained in exactly the position it had been in since the paramedics brought Reyes through the door. There was nothing on that footage that supported Hale's implication. Not a frame of it. She copied the timestamp range to the file she'd been building. Since the IG inquiry opened not formally, just organized. The way she'd been trained to organize information in environments where the record was the difference between a good outcome and a bad one. "I need the paramedic handoff report from Reyes's transport," she said to Torres. "Already pulled it." He set a printout on the counter beside her. She read it. The paramedic's notes documented the empalement on scene, the angle of entry, the field dressing, the initial vitals. They also documented that the object showed no evidence of displacement during transport, that the entry wound was consistent with the incident report from the explosion site, and that the stabilization on arrival at Coastal Ridge had been performed by the receiving nurse, her name, Claire Navarro, listed explicitly. The injury was documented from the scene, not from the ER, not from anything she had done. She set the printout down. She picked up her phone and called Colonel Farrow. Farrow answered on the second ring, which meant she already knew. "I've seen it," Farrow said. "The footage contradicts every element of the causation claim," Claire said. "The paramedic report documents the injury from the explosion site." The bay camera shows both my hands at all times during the ultrasound. There's no contact with the rod until the brace was applied, and the brace is documented in the nursing record with a timestamp. I know. Then what is he actually trying to accomplish? A pause. Delay, Farrow said. If the story runs long enough and generates enough noise, it creates a narrative problem for the IG inquiry. Competing accounts in the public record make the institutional review more complex. It buys time for the hospital's board to build a parallel process that could challenge federal jurisdiction. Another pause, shorter. It's not a stupid strategy. It just requires a claim that can survive at least 48 hours of scrutiny. It won't. No. But is all they need to file a motion contesting the federal oversight framework. Once that's in the legal system, the inquiry gets stayed pending jurisdictional determination. And how long does that take? Weeks, possibly months. Claire stood at the nursing station and looked at the ER board. 12 patients, Torres managing the flow. A resident she'd worked with for 2 years making a decision about bed 8 with the particular focused expression of someone who had learned something in the last 24 hours about what it looked like to actually decide. What do I do? She said. You give me everything you have, Farrow said. Right now, everything. I'm going to forward it directly to the IG team and get it into the formal record before end of business today, which closes the window on the delay strategy. She paused. Can you compile it in the next 2 hours? 1 hour, Claire said. She hung up and started working. Took 53 minutes. She compiled the bay camera footage segments with timestamps, the paramedic transport report, the ultrasound imaging file with its metadata intact, showing time of acquisition, the nursing notes she'd filed with their original timestamps, the blood pressure logs showing Reyes's vitals from arrival through OR transport, and her own contemporaneous notes from the night shift, the ones she'd been writing at the nursing station when Torres had found her. She also pulled the Ramos record from the morning before the EKG, showing the patient's deteriorating status, the timeline of the intervention, the cardiology attending's note from afterward that explicitly stated the decompression had been clinically indicated, and that delay would have resulted in a cardiac arrest. She organized it into a single transfer file with a cover document that was 3 paragraphs long, what each piece of evidence was, what it showed, and what it contradicted in Hale's public statement. She did not editorialize. She did not use words like false or malicious or calculated. She described what the record showed and let the record speak, because the record was the only thing in this situation that could not be coached or revised or strategically timed. She sent it to Farrow at 1,538. Farrow replied in 4 minutes received. IG team has it. Good work. Claire set her phone down and went back to the board. She found out about the press conference response the way she found out about most things that happened outside her immediate field of vision through Torres, who had a gift for situational awareness that she had come to rely on the way she relied on good equipment. At 1,620, Torres appeared at her shoulder while she was finishing a wound assessment. The Naval Base Public Affairs Office just issued a statement, he said. She finished the assessment and looked up. They named the 10 casualties, he said. Not by name, by status. They confirmed all 10 were treated at Coastal Ridge and are alive. They confirmed that the initial treatment in the ER was performed by nursing staff, while the senior physician on duty was, and I'm quoting, non-responsive to the demands of the mass casualty situation. He paused. They also confirmed that Commander Reyes's impalement injury was documented at the explosion site prior to transport with photographic and witness evidence, and that the injury arrived at Coastal Ridge in the condition described in the paramedic report. She set down her gloves. They held a press conference, she said. Not exactly. They sent a 2-page statement to every outlet that ran Hale's clip. With attachments. Torres had the particular expression of someone who had been waiting a long time for something to go a specific way. One of the attachments is a still image from the explosion site showing the impalement injury in situ before transport. Timestamped. The statement had been ready before Hale went on camera. Someone has anticipated the move and prepared a counter before it landed. She thought about Pharaoh, answering on the second ring. She thought about the Admiral in his working uniform, no ceremony, moving fast. She thought about what it meant that they'd been building a response package before she'd even called. The wire service already updated their story, Torres said. The 3 local stations have requested comment from Hale's legal representative. He paused. He doesn't appear to have one retained. He reached out to the hospital's legal department this afternoon and was informed that the hospital cannot provide representation in matters where hospital itself is a subject of review. She looked at him. Gerhardt told him that, Torres said. Personally, in writing, she understood what that meant. The hospital's legal team had just publicly separated themselves from Hale's claim, which was not a coincidence and was not subtle. The board had looked at the emerging situation. The board had looked at the emerging situation and made a calculation about which way the weight was shifting, and they had adjusted their position accordingly. The way institutions always adjusted when the alternative was to go down with someone who was no longer useful to protect. Hale had walked out to that podium, believing he had institutional backing. He had been wrong by approximately the time it took the Naval Affairs Office to send an email. At 1715, Special Agent Kowalski from the IG office appeared on the ER floor with a second agent Claire hadn't seen before. They were looking for Torres, who directed them to the nursing station, where the archived footage was accessible on the clinical system. They spent 40 minutes reviewing files. They asked Claire 3 questions, all procedural, all of which she answered with specific references to the documentation she'd already sent to Pharaoh. The second agent took notes. Kowalski thanked her, and they left. An hour after that, the hospital's chief executive officer, a man named Pritchard, who Claire had seen perhaps 4 times in 4 years, always at a distance and always moving in the direction of somewhere else, walked onto the ER floor unannounced. He was accompanied by 2 board members she recognized from their photographs on the hospital website, and by the senior partner from an outside law firm, whose name she didn't know, but whose suit cost more than her monthly rent. They asked for a private space. Torres opened the family consultation room. Claire was not invited to the meeting, which was its own information. The meeting lasted 22 minutes. When Pritchard came out, he walked directly to the nursing station and asked Torres to find Ms. Navarro. She was already there. Pritchard was 60, heavyset, with the specific discomfort of a man who was accustomed to problems resolving themselves before they reached him and had now been handed one that had not. He looked at her with an expression that was trying to be neutral and landing somewhere closer to pained. "Miss Navarro," he said, "on behalf of the hospital administration and the board, I want to express..." Mr. Pritchard. She kept her voice even. "I have a patient in Bay 7 who needs a dressing change. If there's something you need to tell me, please be specific and brief." He blinked. "The board has voted to formally withdraw the suspension action," he said. "Completely. It will be expunged from your personnel record. The board also wishes to extend an apology for the manner in which..." "What about Dr. Hale?" He looked at the outside lawyer, who gave a small nod that meant this is already decided. It's safe to say it. "Dr. Hale has been placed on administrative leave, pending a formal disciplinary review," Pritchard said. "The review will address his conduct during the mass casualty event and his public statements this afternoon." He paused. "The hospital has also agreed to cooperate fully with the Inspector General's inquiry." She looked at him. "And Ms. Morse?" she said. Another glance at the lawyer. A longer pause this time. "Mrs. has submitted her resignation," Pritchard said. "Effective immediately." The ER made its noise around them. Monitors, Mosid voices, the ambient, sound of the place working the way it always worked. "Thank you," she said, "for being specific." She went to Bay 7. She finished her shift at 1930. She sat in her car in the parking lot for a few minutes before driving anywhere, not thinking. Exactly, just letting the day decompress the way you had to let it decompress when it had been the kind of day that didn't have a clean edge. The smoke over the naval complex was completely gone now. The sky was dark and ordinary, the same sky it always was, with the same distant lights from the base, showing through the trees at the waterfront. Her phone had 17 unread messages. She scrolled through the senders without opening them. Faro, Torres, twice, a number she didn't recognize that turned out to be the Naval Base Public Affairs Office, 2 from the union representative, who had apparently been following developments and wanted to discuss her options, and 1 from a local journalist whose name she recognized from the station that had run Hale's clip first. She didn't open any of them. She opened the one from Walsh, just saw the news. Saw the Navy statement, "You okay?" She typed back, "Fine. Glad Decker is stable." Walsh replied, "In 30 seconds. He's already complaining about the hospital food." Good sign. Claire almost smiled. She put the phone in her jacket pocket and started the car. She was 2 blocks from the parking lot when the phone rang through the car's system. "Reyes," she answered. "Are you driving?" he said. "Yes." "Pull over." The quality of his voice had changed from the ICU, still rough from the tube, still careful from the incision, but carrying something underneath that made her take her foot off the gas. She pulled to the curb. "What happened?" she said. "The IG team was up here an hour ago," he said. "They wanted a formal statement from me about what happened in the ER. I gave it. A pause. They also showed me what they found when they pulled Hale's communications from the last 48 hours. She waited. "He didn't act alone," Reyes said. She was quiet. "The press conference was coordinated," he said. The talking points, the timing, the specific language he used about the military record it was drafted. Not by him. He's not sharp enough to have built that by himself, and the framing of to have built that by himself. And the framing was too targeted, too legally precise for someone improvising. He paused, and she could hear him managing the pain of the conversation, the careful breath between sentences. They traced the draft document on his computer. It came from an external source, someone who knew the specific regulatory language around civilian facilities and federal medical oversight, well enough to construct an argument designed to delay the IG inquiry for exactly the window they needed. "Who?" she said. "That's the part the IG team hasn't confirmed yet," he said. "But the metadata on the document shows it was created on a device registered to Coastal Ridge Medical Center's administrative network." Another pause. Not Hale's device. Not Morse's device. She gripped the steering wheel. "Pritchard," she said. "They don't know yet," Reyes said. "But I want you to know before they come back to you with it. Because they will come back to you, and it's going to change the shape of what the next few days look like." She sat with that for a moment. The CEO. The man who had walked onto the ER floor 2 hours ago with his board members and his outside counsel and delivered his careful, pained apology with the timing of someone covering his position before the ground shifted under it. The apology hadn't been contrition. It had been triage, an attempt to establish a record of cooperation before the document trace completed, and the question of who had built the weapon Hale had fired became formally answerable. "He came to see me tonight," she said. "Pritchard," he apologized. "Voided the suspension, offered cooperation with the inquiry." "I know," Reyes said. "That's why I'm calling." She understood. The apology was evidence of knowledge, not goodwill. A man who hadn't known what was coming wouldn't have moved that fast, or brought an outside attorney to a conversation he framed as an apology. "They're going to want you in front of the IG team again. Tomorrow," Reyes said. "Full formal deposition, everything." "I know." "Claire." He used her name for the first time. Not Ms. Navarro, not the nurse her name. The way people used names when they wanted to make sure you understood they were talking to you specifically. Not a version of you, not the figure in the situation. Whatever happens in that room tomorrow, whatever they ask, whatever they put in front of you, you have the record. Everything you did is documented. Every decision, every timestamp, every clinical rationale. He paused. They built a case against you on paper. Your case is built on what actually happened. She looked through the windshield at the street. An ordinary street, ordinary light, a couple walking a dog on the opposite sidewalk. And if Pritchard had help, she said. If this goes further than Hale and Morse and one CEO with an outside lawyer. Reyes was quiet for a moment. Then the IG inquiry gets bigger, he said. And the people involved get more exposure, not less. Another careful breath. That's not your problem to solve. Your problem is to walk into that room tomorrow and tell the truth. That's what I was planning to do, she said. I know. She could hear the particular quality of a man almost smiling through pain. I just wanted to make sure you knew the full picture going in. She started to say something and stopped. Her phone buzzed with an incoming message. She glanced at the screen. It was from Farrow. 4 words. Check your email. Now, I'll call you back, she told Reyes and hung up before he could answer. She opened her email on her phone, sitting at the curb with the engine running and the heater pushing warm air against her face. Farrow's message was 3 paragraphs and 2 attachments. She read the paragraphs first. The IG team's forensic analyst had completed the metadata trace on the document found on Hale's computer. The originating device was registered to the Coastal Ridge Administrative Network, as Reyes had said. But the user account associated with the document's creation belonged to neither Pritchard nor anyone on his direct staff. It belonged to a board member, a man named Gerald Ashworth, who had sat on the Coastal Ridge Board for 11 years and who, according to the second attachment, also sat on the advisory board of a private hospital management group that had been in acquisition discussions with Coastal Ridge for the past 8 months. She read that sentence twice. The acquisition. A deal in progress, 8 months old, which meant it had been in negotiation since before Claire had walked into Sandra Morse's conference room, since before the suspension, since before any of yesterday had happened. A management group buying a hospital wanted clean books, no federal entanglements, no IG inquiries, no active oversight claims from military command that complicated the liability picture. A nurse with a validated federal appointment and a documented record of overriding the senior physician chain of command was exactly the kind of institutional complication that made acquisition due diligence difficult. Hale hadn't built the press conference strategy. Ashworth had. Hale had just been the face willing to stand at a podium and say the words. She sat with that for a long moment. Then she forwarded Farrow's email to the union representative who'd been leaving messages all afternoon, added 3 lines of her own context and drove home. She slept 6 hours, which was 2 more than she'd expected. She was up at 5:30, made coffee she actually tasted this time, and sat at the kitchen table with Farrow's attachments open on her laptop, reading through the full forensic report with the particular attention she brought to things she needed to understand completely before walking into a room where they would be discussed. The deposition was scheduled for 900 at the federal building. She arrived at 845. The conference room on the 4th floor had more people in it than her first visit to IG agents, a JAG officer in uniform, Farrow, and a woman from the Department of Justice who had driven up from the regional office that morning and whose presence confirmed that the scope of what had started as a military oversight inquiry had expanded into something with a broader legal architecture. There was also a court reporter in the corner and a camera on a tripod that would record the deposition for the formal record. Claire sat down, stated her name and credentials for the record, and answered every question they asked her for 3 hours and 40 minutes. She answered them the same way she'd answered the Admiral's question 2 nights ago, in the ER directly, specifically, without editorializing, without softening anything, without overstating anything. When she didn't know something, She said she didn't know. When she had documentation to support an answer, she referenced it by the file number she'd assigned it when she compiled the packet for Pharaoh. When the JAG officer asked her to walk through the ultrasound findings on Reyes in real-time technical detail, she did it without being asked twice, drawing on the image on the laptop screen they'd provided and annotating it in the air with her finger, the way she'd have annotated it for a resident. The DOJ attorney asked the question she'd been expecting: had she at any point during her time at Coastal Ridge Medical Center been aware of the hospital's acquisition negotiations with the private management group? She said, "I found out last night." And had you been aware? Would it have changed any of the decisions you made during the mass casualty event? She looked at the attorney. "No," she said. The attorney wrote something down. At 1247, the lead IG agent thanked her and told her the formal record was complete. He did not tell her what the findings would be. He didn't need to. The DOJ attorney's presence in the room had already told her that. She walked out of the federal building into cold November air and called Torres. "How's the board?" she said. "Full," he said. "Vasquez is managing." Two of the residents from the other night asked specifically to be scheduled with her because, apparently, he paused. They said she reminded them of someone. She didn't say anything to that. "Hale hasn't been back," Torres said. "His office has been dark since yesterday. Someone from HR came and took his personal items this morning. His review is still pending." His review, Torres said carefully, is not the only review pending. He paused. Pritchard was in a closed meeting with the board and the outside counsel from 7 this morning and till about an hour ago. He came out and went directly to his car. He didn't stop at his office. "Do you know what was decided?" "Not officially." Another pause. But the board chair sent an email to all department heads 11 minutes after Pritchard left the building. Subject line: interim leadership transition. No body text yet. She stood on the sidewalk outside the federal building and processed that. "Okay," she said. "Claire." He used her name, which he did rarely enough that she noticed. "When are you coming in?" "I'm not scheduled today." "I know that. When are you coming in?" She looked at the sky. Clear today, the haze from 2 days ago completely gone. Just ordinary November sky over Bellport with the smell of the water somewhere underneath the cold. "Tomorrow," she said. "Morning shift." Gerald Ashworth resigned from the Coastal Ridge Board of Directors at 3 p.m. that afternoon. The hospital's communications office released a 2-sentence statement confirming his resignation, citing a conflict of interest related to ongoing regulatory review. They did not specify the nature of the conflict. They didn't have to by 3 p.m. The wire service that had run Hale's story 2 days ago had already published a follow-up piece detailing the acquisition negotiations, the board members' dual role, and the IG inquiry's expansion into potential coordination to obstruct a federal oversight proceeding. The story ran with the Naval Affairs Office's statement as a sidebar, including the time-stamped photograph of Reyes's impalement injury at the explosion site. Hale's press conference clip, which had been viewed 40,000 times in the first hour after it aired, now existed primarily as the first half of a before and after narrative that other outlets were building around the subsequent 48 hours. By evening, the regional story had been picked up nationally, not as a breaking news item, but as a feature. The kind of story that got assigned to someone with time to report it properly, with the shape of an institutional failure, and the figure of a person who had walked through the middle of it, doing the only thing she knew how to do. Claire did not watch the coverage. She had never been good at watching things she couldn't affect. She went for a run, instead, 4 miles along the waterfront path, the cold air sharp enough to make her lungs work for it, the water dark and flat to her left, and the lights of the naval complex visible across the harbor. She ran the way she worked, no headphones, no distractions, just the physical fact of it, one foot and then the other, the body doing what it was built to do. She got home at 1740, and showered and was eating dinner when her phone rang. "Admiral Blackwell, sir," she said. "Commander Reyes is being discharged tomorrow morning," he said. "He wanted you to know. That's fast. He's motivated." A pause brief. "He also signed to tell you something himself, but wanted to tell you something himself. Confiscated his phone an hour ago because he was using it too much, and it's affecting his recovery." She almost smiled. "What did he want to tell me?" "He wanted to tell you that he submitted a formal written commendation for your record this afternoon. Detailed, specific, signed, and filed with the DoD Medical Command." A pause. "He said you'd probably object to it." "I don't object," she said. It wasn't about commendation." "No," the Admiral said. "It wasn't. That's why it carries weight." He was quiet for a moment, in the particular way. He was quiet, the pause of a man who had decided what he was going to say next, and was simply giving it the right amount of space. "The IG inquiry has been formally expanded to include the acquisition coordination and Ashworth's role. The DOJ is handling that aspect. It's outside my lane now, but it will move." I figured. "Pritchard submitted his resignation at 5 o'clock, he said. The board accepted it. She set down her fork. 2 days. The nursing director, the chief of trauma surgery, the CEO, and the board member, whose acquisition strategy had turned a mass casualty event into a liability calculation. 4 people who had looked at her experience as an obstacle or a threat or a complication, and who had spent the last 48 hours discovering what happened when the thing they'd tried to suppress was also the thing that was documented in every camera and every chart and every military record and every paramedic report and every single timestamp in the system. "What happens to the acquisition?" she said. "The management group withdrew this afternoon." His voice was neutral, but she could hear something underneath it, not satisfaction exactly, but the specific quality of a man who had seen situations resolve the way they were supposed to resolve, often enough to recognize it when it happened. "Due diligence concerns." She picked her fork back up. "Colonel Farrow tells me you completed the deposition," he said. "This morning." "And the appointment letter?" She looked across the room at the kitchen counter where the letter was sitting, still folded in the same position it had been since she brought it in from her car last night. She'd looked at it 3 times today without opening it. Not because she didn't know what she was going to do, because it was the kind of decision that deserved to sit for exactly as long as it needed to sit. "I need to ask you something," she said. "Go ahead." "The program, the training curriculum. What does it actually look like? Not the formal description. What does a day look like?" He considered the question. "Candidates come in with field medicine backgrounds, experienced medics, some with combat rotations, none of whom have seen the specific injury patterns that come out of maritime and coastal operations. You build the scenarios. You run them through it. You evaluate, you correct, you build the next scenario based on what they got wrong." He paused. "You also write the curriculum, the actual framework from scratch, because nothing adequate exists yet." Another pause. "It's not a desk job. You'd be on your feet as much as you are now, maybe more. The difference is that the people in front of you are trying to become the person you already are." She sat with that for a moment. "I'll sign it tomorrow," she said. He was quiet for exactly the right amount of time. "All right," he said. "Before I do, I want to finish my morning shift." "Of course. And I want it on record that I'm taking the commission because the work matters, not because of what happened here." "It's already on record," he said. "I wrote it myself." He said goodnight and hung up. Claire finished her dinner in the quiet of the apartment, the familiar white walls and the practical furniture and the bookshelf arranged by use, the photograph on the windowsill showing 4 people in front of a vehicle in a place without a name on any map she'd been given. She looked at it for a moment. She didn't usually look at it. She went to bed at 9 o'clock and slept straight through until the alarm. Morning shift started at 600. She was there at 545, coffee in hand. The same time she was always there, the board filling up, the same way. It always filled up on a Wednesday morning in Bellport. Torres was already at the station with the handoff notes from the night team, reading through them with his reading glasses on, the small silver frames he'd started wearing 6 months ago, and still seemed faintly embarrassed by. "Morning," he said without looking up. "Morning," she said. She put her coffee down and pulled up the board. 14 patients, 3 in active monitoring, 2 awaiting discharge, the rest in various stages of workup. A normal morning. The ordinary complexity of a trauma ER doing what it did, patient by patient, problem by problem, the long, undramatic grind of keeping people alive. She worked for 4 hours. She saw a 61-year-old man with a suspected pulmonary embolism and got him into CT within 30 minutes of presentation, catching it before it converted. She talked a young woman through a panic attack that presented as cardiac symptoms until her physical vital signs resolved, and gave her a referral she actually followed up to make sure existed and had an opening. She helped a third-year resident work through a differential diagnosis on a patient whose symptoms were ambiguous enough that getting it right required slowing down and thinking rather than defaulting to the most common explanation. And she watched him get it right on his own, mostly with her standing 1 step back and saying 3 words at exactly the right moment. At 1015, Walsh appeared in the ER doorway. She wasn't a patient this time. She was in uniform, her right leg moving with the slight careful quality of someone still favoring a healing wound, but upright, weight-bearing, functional. She had a folded piece of paper in her hand. "I'm not supposed to be in the ER if I'm not a patient," she said. I asked Torres. "He said you had 2 minutes." 2 minutes, Claire confirmed. Walsh held out the paper. From Commander Reyes. He got his phone back this morning. It was a handwritten note, which was unusual enough in itself. The handwriting was precise and slightly compressed, the writing of someone accustomed to filling out forms in small spaces. It said, "Navarro, the brace held. Remember that. Reyes." She looked at it for a moment. He also said. Walsh hesitated. "He said to tell you that the training program is going to change things. I've seen a lot of initiatives from command, and most of them don't change anything. But this one will, because the person actually knows what it costs when it doesn't work." Claire folded the note and put it in her scrub pocket. "Tell him I said the circulation came back," she said. "He'll understand." Walsh almost smiled. She turned to go and then stopped. The news thing, all of it. Hale, Ashworth, the whole situation. People are talking about it. She looked at Claire directly. "I know you probably don't care about the talking, but I wanted you to know that the people who were in those beds that night, we're talking about it too. Differently. Go rest your leg," Claire said. Walsh went. At 1130, she signed the appointment letter at the nursing station, which was not a ceremonial location and had no witness beyond Torres, who noticed what she was doing, said nothing, and slid her a pen when the one she was using started skipping. She signed her name. She dated it. She folded it back along its crease and put it in the envelope that had been in her bag since the Admiral handed it to her 2 days ago. Torres looked at it. "When do you leave?" he said. "Program starts in 6 weeks. I'll finish out the month here." He nodded. He was quiet for a moment in the way Torres was quiet when he was deciding whether to say something. "You know I'm going to have to train someone to fill your spot. You'll find someone." "I'll find someone good," he said. Not the same thing. She looked at him. 18 years in this ER. 2 kids in college. A wife who made excellent bread, which Torres had brought in once for a department birthday, and which Claire had eaten more of than she'd intended. A grandfather's photo in the corner of his locker. A man who had managed the department's worst nights for nearly 2 decades with a steadiness that she had relied on. So completely, she had almost stopped noticing it, the way you stopped noticing the floor only when it wasn't there. "Torres," she said. "Yeah, you're the reason this floor runs." He looked at her with the expression of someone who had received a compliment they weren't entirely sure what to do with. "Well," he said, He picked up his clipboard. Go finish your shift. The formal IG findings were released publicly 3 weeks later. She was in her apartment packing the last of the medical texts when her phone filled up with notifications. She read the summary on the IG office's website, sitting on the floor between 2 open boxes, still in the clothes she'd packed in. The report was 47 pages. The summary was 3. It confirmed that Claire Navarro's actions during the mass casualty event had been clinically appropriate, medically sound, and directly causative of positive outcomes for all 10 casualties. It confirmed that the suspension issued by Sandra Morse had been retaliatory in nature and procedurally improper. It confirmed that Kevin Hale's public statements had been factually false on the points of injury causation and credential misrepresentation, and that those statements had been made with knowledge of their falsity. It confirmed that Gerald Ashworth had coordinated the timing and content of Hale's press conference with the intent to delay federal oversight proceedings, and that this coordination constituted obstruction of a federal inquiry. The consequential section was brief. Hale's medical license had been referred to the Virginia Board of Medicine for disciplinary proceedings. Ashworth had been referred to federal prosecutors. Pritchard had negotiated a cooperation agreement with the DOJ in exchange for testimony regarding the board's awareness of the acquisition's influence on personnel decisions. The acquisition itself had been formally abandoned. Coastal Ridge Medical Center would operate under an external administrative oversight structure for 18 months. Sandra Morse was not named in the consequential section because she had cooperated with the inquiry from the first week, providing documentation and testimony that had contributed materially to the findings regarding Ashworth and Hale. She had lost her position. She had lost her professional standing in the way that people lost those things when the record of what they'd done became public and permanent. Whether she would rebuild it somewhere else was not something Claire thought about much, because Sandra's next chapter was not something she could affect. She set her phone down on the floor between the boxes. She thought about what it cost, all of it. The 2 years she'd spent at Coastal Ridge walking the line between what she knew and what she was allowed to act on, the accumulated weight of every time she'd had to navigate between the patient in front of her and the system around her. She'd cycled professionally. She thought about the 6 years before that, the places without names, the decisions made with nothing but her own judgment, and whatever she had in her hands at the time, and the fact that she was still measuring the distance between those two kinds of work, still carrying the gap between them like something that hadn't resolved. She thought about what Reyes had said in the ICU, the people trying to learn to be the person you already are. She thought about what that meant, not as a compliment, but as a description of a problem with a practical solution. There were medics in the field. There were medics right now making the same decisions she'd made, with the same gaps in their framework, in environments where a 4mm margin meant everything. And a 90-second delay was the difference between someone going home and someone not. The gap existed because nobody had built the curriculum to close it. Not because the knowledge didn't exist, but because the people who had the knowledge were busy using it on individual patients, one at a time, instead of multiplying it. That was what she was going to do. She was going to take everything she had learned in the place of names and everything she had learned in 4 years on an ER floor, where she hadn't always been allowed to use it, and she was going to build something that outlasted her, a structure, a standard, a body of trained people who would move into the field with a framework she gave them and would save lives she would never see and never know about. That was not a small thing. It was, in fact, the largest thing she had ever been asked to do. She was not sure she was equal to it. She was sure she was going to find out. She reported to the Special Operations Medical Command Facility at 600 on a Monday morning in December, 3 days after the IG report became public. In the same way she'd arrived at every shift she'd ever worked early. No jewelry, hair pulled tight, hands ready. Colonel Farrow met her at the security checkpoint. Major Navarro, Farrow said. It was the first time anyone had used the rank. Claire's let it settle, the way you let any new weight settle when you first picked it up, not fighting it, not leaning into it, just finding where it sat. Colonel, she said, the first candidate cohort reports in 4 weeks. Farrow walked beside her through the checkpoint, into the corridor beyond. 12 medics, 3 with prior combat rotations. 9 who've been in field positions but haven't seen maritime or coastal injury patterns. Mixed experience levels, which is intentional. You'll be building the curriculum to accommodate the variants. I know. Your office is at the end of the second corridor. It's smaller than you probably deserve. I don't need much space. You'll also have a simulation lab, a clinical observation suite, and access to the hospital's trauma bay for live integration exercises. Farrow paused at a door and held it open. The curriculum framework is yours. We have a suggested structure from the planning team, but minus... I'll read the suggestion, Claire said, and then I'll build what the training needs. Farrow looked at her. Then she nodded, not the nod of a senior officer tolerating a junior one's assertiveness, but the nod of a person who had just confirmed something she'd expected. Good, she said. The office was indeed small. It had a desk and a chair and a whiteboard that covered most of one wall, clean and blank, waiting. A window that looked out over a practice field where, in the distance, a group of personnel was running a physical exercise in the early morning dark. The light was just starting to change on the eastern edge of the sky, the first gray-blue of December dawn coming in over the water. She stood at the window for a moment. She had been the nurse no one listened to. She had been the woman in the conference room being told that her experience was irrelevant, that her instincts were a variance, that the system she was existed to protect people from exactly the kind of judgment she was exercising. She had folded the paperwork and put it in her pocket and gone back to work, because that was the only thing she had ever known how to do when the room told her. She was wrong. Go back to work and let the work answer. The work had answered. It had answered in 10 beds in a trauma bay in Bellport, Virginia, on a Tuesday afternoon when the floor moved and the smoke rose and everyone who was supposed to act didn't. It had answered in a brace built from a trauma board and rolled gauze, holding 4 millimeters of clearance steady while an elevator climbed 6 floors. It had answered in a young woman's foot, tingling back to life. In a burned patient from Pensacola asking about the weather. In a warrant officer who would complain about hospital food and not understand what it meant that he was alive to do it. The answer was not that she had been right and they had been wrong, though that was also true. The answer was something harder and quieter than that. The answer was that competence was not optional and that the systems built to manage it were only as good as the people willing to hold them accountable. And that sometimes accountability looked like a nurse with a 14-gauge needle and a decision that could not wait. She turned from the window. She uncapped the marker for the whiteboard. She wrote one thing at the top of the blank space. In the clean block letters of someone who had learned to write legibly in difficult conditions, what the field needs. And then she started building. They had tried to erase her with paperwork. She had answered with everything that paperwork could not contain: 6 years of deployment medicine, 4 years of a level 1 ER, 48 hours that 11 different cameras and 47 pages of federal findings had recorded in permanent, unambiguous detail. They had called her reckless. They had called her a liability. They had called her insubordinate, out of scope, dangerous, variance, an inconvenience, a problem to be managed. She was a major now, with a command and a curriculum and 12 medics arriving in 4 weeks who needed what only she could give them. She was the person who had walked back through doors she wasn't supposed to enter with a suspension in her pocket because 10 people were dying, and she was the one who knew what to do. That had always been true. It just finally had the paperwork to prove it.